Hello viewer, welcome to this amazing segment. Today we are having a unique segment where we mark the World Heart Day every 29th of September every year. Before we delve into the discussions, let me share a few worrying statistics. Number 1 in 3 cardiovascular disease deaths occur prematurely in people below the age of 70. Number 2, more people die from cardiovascular diseases worldwide than from any other cause, and that is 18.6 million deaths every single year. Number 3, 85% of these cardiovascular disease deaths are due to heart attacks and strokes. In studio today, I'm joined by a team of doctors from Prime Care Health Clinic, Nairobi Hospital. We have Dr. Martin Wanyoike, who is a heart specialist. We also have Dr. Winnie Nyabuti, who is a physician. Now, as we get into the conversation, I would like to invite Dr. Wanyoike to tell us, I know I have said the heart. What is the heart? What is the function of the heart?
Yes, the heart is one of the most important organs in the body. And the heart is actually located on towards the left side of the chest. And it is protected by the ribs so that when you get injuries, you are not insulted. And the heart itself, its function is as a pump. It pumps blood. And that blood is received by the veins and then is injected out and go out from the heart through the arteries. The main artery from the heart is called aorta. And that aorta goes and gives branches to the arms. It gives branches to the neck, and then there are vessels going to the brain, the arteries. Then the aorta goes down and distribute blood to the intestine, to the kidneys, to the legs, and eventually now that blood reaches the legs. And these conduits, which take blood from the heart to the organs, are called arteries. Then this blood goes and the vessels go reducing in size and numbers until they become what are called capillaries. At the capillary level, that's where the oxygen enters the cells, that's where the glucose enters the cells, and this blood now takes also carbon dioxide. And then that blood with carbon dioxide collects into veins. And those veins, they actually collect together, and in the abdomen, we have a structure called inferior vena cava. That inferior vena cava is the one who takes blood to the right side of the heart. This blood taken to the right side of the heart from the abdomen, from the upper part of the body, it is superior vena cava. And those one now go to the tube of the heart, the chamber of the heart called right atrium. In that right atrium, the blood is taken to the right ventricle, and this blood has no oxygen. That is one now pumped to the lungs to get the oxygen. So in fact, the heart has 2 pumps. There is a pump which pumps blood to all parts of the body. That is the left ventricle, and the left ventricle is where we actually get problems of hypertension. High blood pressure, when we talk about high blood pressure, it is the pressure in this system where from the left ventricle to the aorta, that when the pressure is high, we call it hypertension.
So you have stated that the heart pumps blood into and out of the heart.
It is actually pumps, no, it doesn't pump blood into and out of the heart. The blood, the heart pumps blood to the aorta. That is the artery. But then this blood, when it goes down eventually, is going to be in veins. And the veins, we have the conduit now entering the heart from the abdomen, is the one we call inferior vena cava. From the head and the arms is superior vena cava, and they converge into the right atrium. Now in the right atrium, this blood has no oxygen. And this one now without the oxygen is one we say now is pumped to the lungs through the right ventricle. So in essence, the heart has 2 pumps. There's a pump which pumps blood from the left ventricle to the aorta, to all parts of the body. Then there is the one which receives the blood which has no oxygen, the right ventricle, and that right ventricle pumps blood to the lungs to get the oxygen. So the one pump takes blood to the oxygen, to the lungs. Another pump takes blood to the aorta. And those are the 2 pumps I'm talking about.
Thank you so much. That was very detailed.
Yes.
Now, it's also challenging my biology. I know the biology we had in class. But one question I'd ask Dr. Winnie. Now, he has explained in detail of what the heart and its functionalities are. Now, assuming my heart has a problem? How am I able to notice that this heart of mine is not working as per the capacity that it was built to work in?
Okay. So as Dr. Wanyuke has rightly said, the function of the heart is to pump blood out to other parts of the body. And that blood is important because blood carries a lot of things that is essential for your body to function optimally. So blood contains oxygen, which is required for every part of your body. It also has nutrients that are supplied to the organs that are functioning. And it also has things that are helpful for the body to function, things like hormones that are able to regulate your metabolism, your day-to-day hormonal balances, which are essential for your body to be able to function. So when the heart has a problem, all those functions will be affected. The other thing that Dr. Wanyuke has rightly said is the blood pressure is also part of the function of the heart. Remember, the blood pressure, when it's high, it has impact on the lining of the blood vessels, and that has catastrophic effects on your health. In that, when there's injury to the lining of the blood vessels, there are things that will start to develop that will hamper the function of the heart. When blood pressure is a product of something that we call cardiac output plus the systemic vascular resistance. And the cardiac output is the amount of blood that is pumped out of the heart. And it is a combination of stroke volume, which is when the heart contracts once, it pumps out blood, and that is called the stroke volume. You multiply that with the number of heartbeats you have in a minute with the heart rate, gives you the cardiac output. And the cardiac output is supposed to be essential for every part of your body to function optimally. So when there is a problem with the heart and there's a problem with the vessels of the heart, blood won't get to every part of your body as required, and every part of your body will start having signs of deficient blood supply. And those are the signs that now will manifest and become symptoms, and now will bring patients to hospital.
Oh, okay.
Yes.
Now, before we get into the symptoms, what could be the cause of the heart not working up to optimability as it's supposed to work?
So the heart can either have a structural problem, in that there's a problem with the heart, and it can also have a functional problem where there's either something that is hindering its functionality. So when you have risk factors, things that make the work of the heart difficult, or things that can predispose you to certain diseases, which are called the cardiovascular diseases, it hampers the function of the heart. So these risk factors are things that we are going to be discussing. They're the issues that will bring about the function of the heart failing and cause the cardiovascular disease that we'll be discussing. The risk factors that we talk about are things like hypertension, when you have very high blood levels, very high blood pressure in your body, that has an impact in your heart, in that it strains your heart to function. And when the heart is strained to function, there are modifications that the heart will try to do to adjust to that high blood pressure. But over time, when those modifications and adjustments fail, you start having heart failure.
Okay.
Yes. Other things that can also hamper the heart to function are things like when you have diabetes, when you have obesity, when you have very high cholesterols in your blood, those can also cause your vessels to narrow and also hamper the heart. Remember, the heart as an organ also requires blood. So as it pumps blood out of the body, it also needs blood to function. And when you have things that affect the vessels that supply the heart, it also now causes a structural damage to the heart, and that can cause the heart not to function well.
Thank you so much. Now, which are these cardiovascular diseases that she's talking about?
Yes, the heart diseases, actually there are some you may be born with. Those are, we call them the English word is congenital. Congenital is something you are born with, and usually that is dealt with more by the doctors who deal with the children. The pediatric cardiologists are the ones who see more of those inborn problems. But sometimes because of many challenges, some of them are very hidden. Sometimes they present the first time in adulthood, and we are the ones who see them. So the inborn problems mainly...
So you can be born with them, but
Yes.
they manifest later in life.
Yes, but more commonly is in children. Because of course you start having symptoms when you are young, then you go to a doctor of children, and then they pick them. And many of those ones, the inborn problems, they are mainly the common ones are the hole in the heart, where that the four chambers, there is a hole between that they are communicating and make that not function. But for us adults, the most common cause of actually a weak heart in Africa, because that's where we practice, is actually blood pressure which has not been treated properly. The most common is that where we have high pressure, many people, of course, we diagnose the pressure, some of them don't know. People have done studies in this country and have actually noted that people with high blood pressure, the ones who know they have a problem, are only 30%. 70% don't know. Then the other worrying thing is that there's a target blood pressure we aim at. And that one we probably will come with the discussion as we go along. But that target blood pressure of 130/80 for the people below the age of 60 is probably achieved in 10% of the people who are taking medication. And it has even been shown, even in Western countries where they have better health facilities and follow-ups, the people who have started medicine for blood pressure, half of them are not taking within a year. And that one causes a lot of problems. So we have the most common as high blood pressure, which was not treated properly, that makes the heart weak. The second, number two, probably we get is related to a sore throat children get, and sometimes this one manifests in adulthood in a way because a sore throat between the age of 5 to 15 is not treated properly, may affect the valves. And that is called valvular heart disease. We see it more when the socioeconomic status of a country is low. And in Kenya, that one is coming down. What is actually rising at very high rate in this country is what Dr. Winnie mentioned, where you have, as we mentioned, we said the main pipe of the heart, the main pipe from the heart is aorta. The first branching of the aorta takes blood back to the heart for it to function. And these tubes which take now blood to the heart are called coronary arteries. And coronary arteries are the ones which get clogged because you have smoked, you are not exercising, you have high pressure which was not controlled. Also, the pressure itself risks that blockage. If you have high cholesterol, if you are not exercising, and you see the theme of that World Heart Day is use heart, no heart.
No heart.
So when you don't use a heart, then your physical activity is low, all those diseases come to you. And of course, I'm very happy your shape is the right one for the cardiologist. we want a weight which is low. And that one is achieved by actually regular exercise, moderating in feeding. Of course, people love food, and some of us are actually, we misuse the organ of feeding.
People love sweet food.
The sweet food also, but all in all, those heart problems which we get related to the blockages of the blood vessels are coming when you don't exercise, when you have diabetes is not picked. Diabetes and smoking are like the same in attacking the heart. And you may be a very good Christian, you don't smoke, but since you have diabetes, which may be unknown to you, then that diabetes is hitting the heart the same way a smoker is being hit by the cigarette. But unfortunately, the problem is sometimes we get people even coming to a clinic who is having diabetes and also a smoker. That is like committing suicide because the heart is hit so hard. So those problems related to blockages of the blood vessels, they are called coronary artery disease. That is where heart attack belongs to. And the stroke and heart attack are the same disease. Because they occur because in the heart, when the deposits of cholesterol on the wall makes the blood vessels of the heart narrow, then that one leads to heart attack. When it occurs in the brain, that is a stroke. They are the one of the same disease, and they have done also statistics very well in developed countries. It is known that the number one cause of death is heart attack, number two are cancers, number three is stroke. And heart attack and stroke are one of the same things occurring in different areas. And really the World Heart Day, what we focus on is really to just prevent, because those heart attacks and strokes can be prevented by using the heart more, by exercise.
Exercising. Yeah. That is amazing. Now, Dr. Winnie, before we go for a short break, he has mentioned most of the causes of the cardiovascular diseases. He has mentioned, I have noticed that they are lifestyle. Is there a possibility of being born with a disease other than what I eat, what I don't do? I don't exercise, I don't eat good food. Do we have other causes of these diseases?
Yes, there are certain diseases that are genetic, and some of the cardiac diseases that are genetic are things like you can have cardiac arrhythmias, which is an abnormal rhythm of the heart, and that can be related to a genetic abnormality that you were born with. There are other cardiac issues, like when you have a cardiomyopathy, where you have maybe the heart is a bit dilated more than the normal, and that could be attributed to certain genes that you inherited that have resulted to you having such conditions. Sometimes hypertension, 90% of the cases we get in hypertension, we usually call them essential or primary hypertension. Sometimes certain studies have attributed that there's an underlying genetic predisposition for you to get the hypertension. So there are genetic risk factors that can push you to getting the cardiovascular disease. However, most of them are coupled with environmental factors and lifestyle factors, such as a lack of physical activity, poor diet, obesity, that is excess body weight, and all that, other things like alcohol, smoking, all that contribute to eventually ending up having a cardiovascular disease. So the genetic aspect is there, but there's a trigger or there's a push that leads you to having the disease.
Okay.
Yes.
We have talked about the risks, the cardiovascular risk factors that we have in related to the heart and the problems of the heart that we are talking about. Would you be willing to give us more of those details?
These factors, yes, these factors is part of what you have passion for. In fact, when you come to my office, to our office with Jabuti, and we are seeing you and taking the history, we must ask you whether, of course, even when you're a Christian, we ask you whether you smoke. that's a standard question. Smoking, we record whether you smoke or you don't smoke. And smoking is one of the risk factors, and we may not dwell on much because I believe that viewers here, they are not smokers. But obviously, the smokers, when they do smoke, they risk their heart attack so much, because what the cigarette, the nicotine does, it allows the cholesterol which you have in your circulation, in the blood circulation, enter the blood vessels very easily. What is more risk for the smoker is that when you get a heart attack or a stroke, the final event is that you have a cholesterol deposit which may be probably 30% blocking the vessel, but then a blood clot forms on top of it. And the formation of the blood clot is the final event. So that a smoker may be having a blockage just 10%, but because of the nicotine effect causing the blood to clot, a clot will form on a cholesterol deposit in a vessel on the heart. That when it happens, heart attack. And really, when a heart attack occurs, if you are not treated, we lose about 30% of the people. And then also when with the treatment, even when you come to the best centers in the world, about 10% of people are also lost, even when you do everything. So smoking triggers heart attack through allowing the cholesterol to enter more and then to create clots. Then of course the other one is high blood pressure. High blood pressure is something which people need to know, they need to be measured. We always say, even if you are a doctor or a nurse, if you are a non-cardiologist, if a patient goes to any doctor, pressure should be recorded all the time. And we know the figures should be, those ones who are less than 60, we want a pressure below 130 over 80. Above the age of 60, 140 over 90 should be the target blood pressure. And when it is high, it needs to be done something about it. Another major risk factor of heart problems is your cholesterol levels. And we recommend that at the age of 40, when you reach the age of 40 for the adults, at least that time you should have a cholesterol check every year. Ideally is to do it at the age of 20, because there are some people, there are some problems of cholesterol which you are born with. And there's an inheritance part, and some people have very high cholesterol, and they are taking the right diet, but they have inherited from their parents because it's cholesterol made by the liver. The amount made by the liver is dependent on your genes. So cholesterol, we need to be checking it and managing it, but obviously your lifestyle part, if you like taking nyama choma on Saturday afternoon, careful plain, that one will cause a lot of cholesterol deposit and many other things. When you take best for breakfast, best, bacon, egg, sausage, toast, those ones, they tend to have very high cholesterol. And obviously the affluence on societies, when we start affording, we used to say, baby, before the economy was very tough, if your take home is more than 30,000, you're already affluent. Maybe now the figure is 50. But but the diet also helps, makes the cholesterol be a problem. Of course, we have mentioned high blood pressure, we have mentioned smoking, we have mentioned diabetes. It's very important also to actually record that if you have kidneys which are not working well, that predisposes to heart problems. Stress is a major issue. Because stress, you just cause everything to go haywire in the blood vessels, and usually the vital event of a heart attack. We say that most of the people get heart attack on a Monday morning, especially when you don't like your boss, when you don't like your work. So doing what you love to do protects you in a way. But many of the times people do things which they don't like to do. They are very angry. Those negative emotions, they are very harmful to the body. And as a good Christian, when you use those, the fruits of the Holy Spirit, they are in you, you protect yourself from heart problems.
Ah, that is interesting. Now, there is a myth that because I'm of this body type, this size, then I might not get a heart attack. Is that true or not?
It is a myth, truly, because there you have, this one is your down, your frame and the weight. But remember, there are many other risk factors. Say if your pressure can still be high when your weight is this way, depending on what you have inherited from your parents. You may be a smoker even much as you are looking very nice in shape, and that one causes problem. You may be somebody who's very angry. Anger, anger, those negative emotions, they are in you. The heart attacks will come in. And also, of course, you may even have diabetes, like the people who have what we call type 1 diabetes. That diabetes where you use insulin, they're usually your size. And those ones also still are predisposed to heart attacks and stroke in a big way because of the diabetes. So what really helps somebody, as probably is going to come with the discussion, is when you have an annual medical checkup. Because all those things are checked. Even when you have done it right, of course, God has given us the ability to choose even food and everything and lifestyle. But if you actually have a checkup even when you are normal, it helps you a lot in picking the problems. And what we actually advocate is the human body should be taken like a car. You take a car for service after 5,000 kilometers, after the age of 40, ideally once a year should be an annual checkup. And ideally, starting at the age of 20, every 5 years, that time when you are young, but after the age of 40, that's when problems start. An annual check helps you to pick many problems so that you're acting on them. Because unfortunately, many of the people, when they get a heart attack, it is when it occurs the first time, and we lose them, and we feel very bad because you check the pressure was very high, you check their cholesterol was very high, they had diabetes they didn't know, and that one now becomes very difficult because you now find if you had not these things were there before, you'd have done so much to protect that person from the heart being injured. Unfortunately, also it's good to mention, when a heart is injured from whatever cause, whether it's injured because there's a heart attack, whether it's injured because the pressure was very high, was not controlled, you start a journey of death. That journey of death is heart failure. When you talk about heart failure, the pumps start failing, a vicious cycle sets in, and bad things happen.
Hi. That is a little bit scary, but I'm glad that after the break we're going to understand better on how to prevent all this that is happening to the heart. But before we get into the break, I would like to ask Dr. Winnie one question. Would I know that I'm going to have a heart attack?
There are symptoms that usually come when you're having a feeling of impending doom. One of the symptoms that you get, but one of the commonest symptoms is chest pain. And that is why we usually tell everyone, do not take chest pain lightly. When you have chest pain, kindly seek medical attention because that chest pain could be arising from the heart. And the typical characteristics of a chest pain that arises from the heart is a chest pain that is on the left side of the heart. Sometimes it goes to the arm, to the shoulder, to the jaw, to the neck, sometimes to the back. And this pain is usually aggravated with movement, activity, with exertion. You get the worsening of the chest pain.
So when you exercise and there's a pain that comes?
Yes, when you try to do something, it worsens. The heart attack is an acute event where the cardiac cells, the cells they call the cardiac myocytes, die as a result of poor blood supply to the heart muscles. And that is an emergency. It's actually an emergency. And you have a very sharp, severe chest pain. Sometimes it can be described as chest discomfort or a chest compression. And it comes with sweating, which is usually called diaphoresis. It comes with a feeling of imminent danger or impending doom. It can come with some epigastric pain sometimes, especially in women. It can't be the typical chest pain. And in patients with diabetes, it can be silent, no chest pain, but you're feeling shortness of breath and you're very tired. So when you have such symptoms, it's good to go to the hospital and get checked and ensure that it is not something that is coming from the heart.
Oh, okay.
There are other forms of chest pains, and this is not the heart attack. This is just coronary artery disease, and it is something stable, but it has the same characteristics, but it is not acute. It's chest pain that comes with exertion, and sometimes when you rest, it goes away. And you might be having other risk factors, as Dr. Onyeka has mentioned. You are having diabetes, you have excess body weight, you're hypertensive, you also have lifestyle issues such as you're taking alcohol or you're smoking, and your diet is not good. You don't have, you're physically inactive. All those compounding together can bring about the cardiovascular disease.
Thank you so much for that. Now we're going for a short break, viewer. Please do not leave. We are going to come back to understand more about the signs and symptoms that Dr. Winnie has been mentioning. We will also get to know how to prevent heart attacks and strokes. So don't go away. Thank you so much, viewer, for staying tuned. Now we have been discussing about the heart. And as we said, on the 29th September of every single year, we have a World Heart Day. And as we commemorate that day, we would like to know our heart. We would like also to use the heart and get to use it well. Now, as we get into the discussion, I would like to invite Dr. Winnie. We were talking about the signs and the symptoms of a heart attack, and you exhaustively highlighted them to us. We understand what those signs are, the symptoms. Now I would like to know, to go a step higher and know, if I have a heart attack today, what should I do? I have had the chest pains, or I'm feeling the pains, the shoulder pains, and I'm assuming this is a heart attack. What is the first thing that I should do?
Okay, so the first thing that you should do is get to a hospital, the first thing, and we usually have a protocol in handling chest pain. Usually the first 10 minutes when you get to a hospital in a good facility, they should have an ECG done. And that way we are able to see if there's any abnormality in the heart, because there are changes that we note in the ECG that will tell your doctor that the heart is either strained or there's an abnormality in the heart. Some of the things that we pick up is medical terminologies like ST elevation, T-wave inversions. Those are things that we pick up in the ECG that tells us that there is a problem with the heart.
Now, before I get to the hospital, is there first aid for someone who is having an heart attack, or we have to get to the hospital?
So chest pains can either coming from the heart, coming from the lungs, or coming from the musculoskeletal structures. So you can't really tell where the pain is coming from unless you go to the hospital and you tell it to your doctor, and the doctor is able to clearly outline that this is a chest pain that is coming from the heart or coming from any other organ that could be around the chest region. So the first thing I would recommend, if it is a patient who has had a previous history of a heart attack, this is a patient who should urgently go to the hospital and report that the chest pains have started and exactly what time it started. You as the patient or the caregiver, I think the precautions you should do is either carry the drugs that the patient is taking or any medical report that the patient might be having, and that will assist the caregiver. But the first thing I would urge is go to the hospital and get an ECG done within the first 10 minutes when you get to the hospital.
You know, that is scary because we come from remote areas. Probably means to the hospital are a big disadvantage to those communities back in the villages. Now, for me to understand on my chances of survival, how long does it take? Let me say I have had the chest pains, I am in severe pain, and I know it's not been diagnosed, but you can tell this is a heart attack. How long do I have before it becoming fatal?
Very good question. In fact, I can also add even what Dr. Gesare was mentioning. You know, there is a ideal situation which probably we have not been able to achieve in this country. But in US, if you get a heart attack, you don't take yourself to hospital. Somebody comes and pick you. You just dial 911. Now that an ambulance comes to you. In Europe, it's the same. In UK, it's 999. And what they have said is that they have set ambulances in the community, and they have time that for every person who is in those communities, an ambulance can access you within 8 minutes. So within 8 minutes, somebody comes to you, so that the treatment is started by the team which come to see you, and they start making the diagnosis and arranging your treatment. Unfortunately, in Nairobi Hospital, we have actually even tried to set that situation where we use the e-ambulance to get that people who are in that e-ambulance call us so that we know this patient is coming. We have not been able to synchronize it. Actually, we had done a lot of work before COVID came. COVID just made us lose our momentum because we had actually arranged it so well, and we are trying to set that protocol where people come to us. It is very difficult situation the way it is, because for you as a person with heart attack, there is very little first aid you can do yourself. And also, Dr. Gesare mentioned, when you get chest pain, about 85% of chest pain are other things. Sometimes maybe even anxiety. Sometimes maybe even things not related to heart problem. But 15% have a condition which may be life-threatening. And those 15% are the ones now we need to, when they arrive to hospital. So the question, the message should be, when you get a chest pain, you should try your very best to go to the hospital. Unfortunately, because of the various factors in our country, especially for those so-called community hospitals, they may not even have that single, simple tool for diagnosing a heart attack called ECG. Sometimes we may have people who will not even be able to interpret it, and we are really challenged because we are not able to optimize the care. But fortunately, at least the major cities, the major hospitals in the city, those things are available, that when you arrive, we're able to do so much when you reach yourself to the hospital. And of course, unfortunately, many people delay so much. Like us, even doctors, when you get a heart attack, you feel it is acid. You know, every time when you get a crisis, you go to a denial. You don't accept it's a problem. But unfortunately, we are unable to do much when you arrive to us. But yourself, there's very little you can do. But the best is to bring yourself as quickly as possible. Like the casualty of Nairobi Hospital, we have trained our nurses that when somebody has reported chest pain, that one is tried very fast. And we have even a statement which we say, door to diagnosis. When you reach the Nairobi Hospital casualty and you have a chest pain, the auditing we do is that when you arrive to the casualty with the chest pain, did you manage to do a door to diagnosis of 10 minutes? And that 10 minutes is when you do the ECG, you have taken the history, and you are able to say within 10 minutes, this person has heart attack. Because heart attack, unfortunately, you have only 6 hours before the heart muscle dies. From the time the heart attack occurs, after 6 hours, the heart muscle has died. And you can't reverse it. And that's what we are saying now. That death of the heart muscle, you start that journey of also death. It's good to mention, because sometimes we don't want to hear death, but that is the reality. And you want that heart muscle to be saved. So we go to door to diagnosis is 10 minutes, and then we say door to treatment should be within 30 minutes. That if you choose to give a medicine for dissolving that clot, you are giving it within that minute. Sometimes we take the patient to theater where we crush that clot. It's called angioplasty, and that one now should be within an hour of arrival. So that door to, we call it go to balloon, where you put the balloon on the clot, it should be within 60 minutes. And it is time so that when we are doing the audit, because we always audit, we always audit ourselves, that if we didn't do it within 10 minutes, we didn't have a diagnosis, within 60 minutes we are not in the cath lab, then you know we didn't do it well and there's room for improvement. But unfortunately, you can only do so much when you arrive. There are many people who want to even say, this heart attack, I start taking aspirin. Sometimes you may take an aspirin because when you have another disease where maybe the aorta has ruptured, it causes more problems. So the Western countries, when the ambulance come and they do the ECG at your house, they transmit it to the doctor. You are able to make the diagnosis very quickly. We always pray that in our lifetime, that will happen in Kenya.
So that means the best bet for a heart attack patient is time. And getting to the doctors in time. The first hour is very important.
You have said it right. We actually say time is muscle. so that you're not wasting any time when a heart attack has occurred. Unfortunately, many people come 3 days later. Sometimes they go to people, our colleagues who have digestive system specialists, but of course an ECG is the one which picks it.
Confirms. Okay. Now, before we get into the prevention of heart attacks and all the heart diseases, cardiovascular diseases that we have been talking about, I would like to know, he talked about aspirin. And generally, okay, from the myths that or from how we associate with these drugs, it's usually assumed that when you have any chest pains, just go get baby aspirin, take, and you're sorted. Now, what do you advise from a medical point of view?
Okay. Aspirin is a type of drug that is usually called a non-steroidal anti-inflammatory drug. And it has its purpose, especially in the secondary prevention of cardiovascular diseases. But studies have shown that there is no role in the primary prevention of any disease. So aspirin has side effects which are also bad to your body if you take it with no indication of taking aspirin. Aspirin can erode your stomach and it can cause bleeding. And if you have other conditions like kidney disease, it can also have an impact on it. Aspirin in secondary prevention is good, especially when you have atherosclerotic disease, where you have either the atherosclerotic disease in your coronary vessels or in your carotid vessels or in your cerebral vessels. All those, aspirin has a role in secondary prevention. But in primary prevention, there is no indication. And please do not take aspirin just because you have a chest pain. Aspirin is given as per the prescription, and it's for special indications, and it is a drug that has side effects. So do not take it just because you have a chest pain.
Okay, thank you so much for that. Now we are coming to get to understand how do we prevent, because I have noticed a heart attack or a stroke is the final. It is the climax of all these problems.
You are too late.
You are too late.
Yes.
Now how
That
do we
is
prevent?
Prevention. Actually, when we are talking about prevention, it's a major topic by itself. In fact, in our clinic, we have actually identified nurse champions who should be leading on making sure the patient who come to see us, we are really focused on their prevention. And prevention, we have 3 tiers. When we are talking about prevention of blood vessel disease and heart diseases, the cardiovascular disease. And the first tier is called primordial prevention. Primordial prevention, we are talking about those situations where you are doing something to the individual who is in front of you to make sure that they don't get risk factors. They don't have diabetes, they don't have high blood pressure, they are not overweight, they are not physically inactive, and they don't have any high cholesterol. So that primordial prevention we focus on the children. In fact, our wish is that the curriculum of children in nursery school, in secondary school, primary school, they are taught the risk of heart problems so that they never initiate smoking. In fact, the initiation of smoking starts when the boys are 13 years old. And sometimes even parents get very surprised when you know this Christian family and my boy is smoking. They get very shocked. But if you teach them about the dangers very early of the dangers of smoking, the dangers of with the driver of diabetes, the driver of high blood pressure, the driver of high cholesterol is actually physical inactivity. Not using the heart, not exercising. So we teach people the importance of physical exercise very early. And when they get it into their DNA, that they have accepted that exercise is part of me. I'm a young boy, I need to do exercise. I'm a young girl, I need to do exercise. They understand that the weight is bad. You know, of course, on Sundays, what all of us we do, we pass through KFC, all those places where we are doing this fast food and all that, and we trigger the processes of actually weight gain. And usually, even in pregnancy, at the time when the lady is expecting, the nutrition you are taking may also affect you in a big way. And the way we advise about low cholesterol diet, the recommendation we give, like when we are preventing heart problems, we say the low cholesterol diet should be started at the age of 2 years. Because after 2 years, you have formed all your cells, that's the time now to start doing something. Then, of course, I'll let Dr. Dechare continue with discussion.
So you have talked of primordial.
Yeah, primordial.
Yeah, so the second, I had there are three 3 sets, eh?
Yes. So the second set is primary prevention, and this is where you screen for the risk factors of cardiovascular disease. This is where you screen patients for diabetes by checking either their fasting blood sugar or their random blood sugar. You can also do a test where you check the blood sugar control over a period of 3 months. It's called HbA1c. You also check things like you do their blood pressure, check their annual checkup of blood pressure. You also do a lipid test, a lipid profile test, where you check their cholesterol levels. And there are patients who have familial hypercholesterolemias, where they have genetic issues with their cholesterol metabolism, and it runs in the family. And those are patients you can pick quite early. And also those patients also who have poor diet can also have high cholesterol as well. You check their weight by checking their body mass index. That is how we check if you are either overweight or obese.
Body mass
index. Yes. Usually it's a calculation you do based on your weight and your height. And if your body mass index is between 25 to 30, you're overweight.
So how is it done? Just for curiosity purposes.
You come, we take your blood, we take your weight, and then we take your height in meters squared. Your weight in kgs. You take your weight, you divide with your height squared. Yeah.
Okay.
And when you get your value between 18 to 24.9, it's okay. 25 to 30 is overweight. Above 30 is obese, and obese also has grades. So that is one of the risk factors we also look at.
Okay.
The other thing is now we clock you, we get your history of alcohol intake. Usually the best and what we advocate for is no alcohol intake. Though there are other studies that may say moderate intake of alcohol is beneficial, but overall, if you're able to avoid alcohol, avoid it overall, yes. Also smoking, even those who have stopped smoking within the 1 year period of smoking, they're still at risk of getting cardiovascular diseases. So, or even passive smoking, where your partner is also smoking, but you're not smoking. Yes, exposure
you're
to
inhaling
that.
What they're smoking.
Yes, what they're smoking as well, yeah.
Okay.
Then the other thing we usually do is now we also check other risk factors. We can check your vitamin D level. Vitamin D has been associated with having low vitamin D has been associated with having heart issues. So you also check your vitamin D levels. Thyroid, we check your thyroid as well, because when the thyroid functions are on overdrive, they can have an impact on the heart. It can cause arrhythmias. They can also cause a strain on the heart because of that. That's a primary prevention, where we screen for the risk factors. Those are the modifiable risk factors. We also ask about your exercise. It's very important because physical inactivity will lead to overweight, will lead to obesity. Obesity will cause a lot of inflammation. It predisposes you to diabetes, hypertension. So it's like a vicious cycle. Yes, and the form of exercise that we usually recommend is moderate intensity kind of exercise. And this form of exercise is either brisk walking until you break a sweat, cycling, you can do swimming, jogging, all forms of exercise. We recommend around 30 minutes
of exercise per day?
Yes, per day, and at least 5 days in a week, totaling up to around 150 minutes in a week, yes. As tolerated, though, because some people might have issues of the joint, so it's good that you also get a good checkup before you start any form of physical exercise. So that is primary prevention.
Okay. Yes. About exercise, I was reading and I learned that if I have high blood pressure, then there are exercises I shouldn't do, because I will be now overworking the body, the heart, but presuming that I am exercising it for probably a better use. Is it true?
No. I think it depends on. Exercise generally is good for the body, and when you have a heart condition, maybe if you're having maybe heart failure, and maybe you're in the acute phase of your heart failure, then maybe you won't be able to exercise, because also the symptoms will hinder or hamper your physical activity.
True.
But once you're treated and you're managed well, we gradually introduce the form of exercises. And what you said is moderate intensity, where you're just doing something that helps you get to a point where you break a sweat. So exercise, all forms of exercise encourage. Maybe the things we introduce gradually are resistance kind of exercises, and that you can do twice a week, but that is as tolerated. The point is as you are able to tolerate, yes,
as an individual.
Yes.
So we shouldn't
Maybe I
flag
should add
it
that
wrong.
one. It was better to actually make it very clear that exercise is part of primordial prevention. When you do exercise, you prevent yourself from getting high blood pressure. If you are physically active, that goes together, that the weight is good, then you are likely to get high blood pressure, even when you are predisposed genetically. And you know that the statistics are very clear. At the age of 40, 20% of people at that age have high blood pressure. At the age of 50 is 30%. At the age of 60 is 50%. Then we even say in medicine, if you live long enough, you get high blood pressure. But preventing you from getting that high blood pressure is actually exercising. Then when the pressure is present, we use high exercise also for helping you to control the pressure. And that part of exercise is the prescription, and that other than the drugs, for helping the pressure down. But what we always want the message to be very clear. You should not exercise until the pressure is controlled, because when you actually exercise, the exercise itself makes the pressure go up. So if you have a pressure which is above 160 over 100, until we are broadly below 160 over 100, we target at 130 over 80 in most people. If you are above 160 over 100, if you exercise and then that pressure reaches 200 over 120, you can rupture blood vessel in the brain, and that has happened. We see people getting a stroke because they are exercising before the pressure is controlled. But when the pressure has gone below 160 over 100, part of your diet, part of your regime for managing that pressure is regular exercise, which he mentioned very well. Brisk walk 3 kilometers at least 5 days in a week. That one, when you do, you are doing that. But when you exercise, some people actually, when they are diagnosed with blood pressure, they say, "We are not taking medicine, I'm going to be exercising." And then they're exercising when the pressure is 160 over 100, they are putting danger on themselves. Yes, because the exercise raises the pressure by itself. That moment you are doing the exercise, and you can rupture blood vessel in the brain and cause another stroke called intracerebral bleed, which is have a mortality of 50%, by the way. Those are very clear. Those are things which people have done the studies, and they're very clear. So exercise, yes, do when the pressure is controlled. Exercise do before you get the pressure, because it will prevent you from getting pressure in the future.
Okay. So that is very clear, my viewer. So get to know where your pressure is before you exercise. But also it's important, as they have said, that have optimal exercises. Moderate exercises, depending on what you're handling. Now that is addressing those ones who are actually handling high blood pressure and any other risks that are associated with the cardiovascular diseases that you're talking about. Now, we have talked of primordial, then we have talked of primary causes, prevention, and now let's talk about the secondary.
Okay. Now, when it comes to secondary prevention, this is where either the patient has had an event, either you have had a heart attack, or you've had a stroke, or you're having heart failure. You're now doing secondary prevention to prevent any other episode from coming about. So the approach in this is either is a combination of both the primary, where you get the primary prevention, where you get the risk factors and control the risk factors, and also now treat the disease to prevent worsening of the disease. So when you get the risk factors, like patients who now have very high cholesterols, and there are patients who are suitable for medication, you put them on medication, and there are various medications that help lower your cholesterol. Some of them are statins, and they help lower your cholesterol. But these ones you don't give in patients who are of childbearing age, because that might have an impact if they get pregnant. The other thing is, if you find that they are either diabetic, you treat the diabetes, and there are medications, either injectables or oral hypoglycemic medications, where you give. If the patients have issues with their high blood pressure, now if they come with either catastrophic events, like they have hypertensive emergency, those are patients you admit and you put them on IV medication, stabilize them, and then you gradually put them on oral medication. If they come with very high blood pressures, 160 over 100 with either target organ damage, you confirm that they have hypertension, you put them on medication in addition to the lifestyle changes that you will have introduced as well. If they have coronary artery disease, so patients, you put them on treatment as well as enforce the lifestyle modifications. Patients who have already had an event, there are patients you have intervened, managed, there are medications we put them on so as to prevent any other event from occurring.
Okay.
Yes.
Just in 30 seconds, can I reverse the effects of, let's say I've had a heart attack? Am I able to reverse the effect?
You can if you come on time before 6 hours are over, because that time the heart muscle has not died, and if you treat you, the heart muscle recover fully. In fact, if you treat a heart attack the right way before 2 hours are over, you actually abort it.
Okay. So time is important, dear viewer. You get chest pains, you break a sweat, as they have said, the signs and symptoms of a heart attack, please get to the nearest clinic or hospital. Now, thank you so much for watching through this session. I'm glad that we have had a constructive discussion with Dr. Winnie and Dr. Wanyuike as we get to celebrate the World Heart Day on the 29th of September of every year. There are a few things I would like you to remember. You need to use your heart, because that is the theme this year. Use your heart, and you need to know your heart. So we've taught you about the heart. Now you need to use your heart. Thank you so much for watching us. As we said, they come from Prime Care Heart Clinic. They have a website, primecareheartclinic.co.ke. We also have a phone number in case you'd like to go further into consultations. Their number is 0710 828016. 0710 828016. You can find them at Nairobi Hospital, Anderson Center, 4th floor, room 2. So thank you so much, Dr. Wanyuike, for joining us in the conversation, and Dr. Winnie, as we get to celebrate the World Heart Day. I pray that we get to, as viewers, we get to use the knowledge that we've learned today.
Are you allowed to give a parting shot? The time is finished.
Yeah, we can give a
parting shot. We have a formula for prevention of cardiovascular diseases, very, very simple. It is called 035 130 530. So the first 0 is zero tobacco. Number 3 is walking 3 kilometers every day. Number 5 is taking 5 servings of fruits and vegetables every day. 130 is your blood pressure to be less than 130 over 80. The next 5 is you should know your cholesterol, total cholesterol. For people who are less than 40, at the age of 40 should be less than 5 total cholesterol. The next 3 is knowing your bad cholesterol, called LDL, should be less than 3. Then the final 0 is avoiding overweight and diabetes, because those are the ones with type 1 diseases.
He has summarized everything in numbers. What is your parting shot, Dr. Winnie?
My parting shot is, in the Bible, Solomon was the wisest man. He said, guard your heart, for out of it comes the issues of life. So it is very important to look after your heart.
Wow, that is profound. Thank you so much for watching. Until next time, it has been Mercy, Dr. Wanyuike, and Dr. Winnie.